Sure. This was Keynote 29 was a study that we started about 3 years ago looking at the combination of Pembrolizumab and Ipilimumab in patients with melanoma and kidney cancer. And in the phase 1 part of the study, which I led, we identified that full dose Pembro was tolerable with a reduced dose of Ipilimumab at 1 milligram per kilogram and showed considerable activity in the subset of patients with melanoma that were in the phase 1 portion. That led to an expansion study in melanoma, the 1B portion, which included about 150 patients, which was largely conducted in Australia and led by Georgina Long, which showed near 60% response rate for the combination in patients with melanoma and a little better toxicity profile than the standard FDA-approved combination of Ipi and Nivo, where Ipi is given at 3 milligrams and Nivo is given at a reduced dose from the single agent dose. So what we're now doing is opening up Part C, which is to see whether we can even go further down on the Ipi dose and still see efficacy. So Part C, which has a poster here, has 2 cohorts of 50 patients each getting full dose Pembro or 200 milligrams every 3 weeks, together with either Ipi at, I believe it's 50 milligrams per flat dose, 50 milligram flat dose every 6 weeks, or 100 milligram flat dose every 12 weeks. And so that's a study that's just opening, and the goal is to see if it's more tolerable than the Part B, where there still were around 42% of patients who had to stop because of grade 3 related, immune-related toxicity.